Welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how to be able to heal both brain and body and know their options for being able to punch pain in the face, whether it's physical or whether it's mental, and get back to leading the life they deserve. Today, we're talking about OCD, or obsessive compulsive disorder. And frequently when people think about this, they think about different activities like washing one's hands excessively. And they think, oh, it's probably not something that's seriously bad. But as we've talked about in other videos, it can be incredibly life-altering. One of the different resources that we used in order to be able to kind of put together this talk today was the International OCD Foundation. In addition, we also looked at Cleveland Clinic and we referenced some of their various different articles and tidbits that are able to kind of, we were able to utilize to be able to kind of put this talk together. So let's talk about the incidence, meaning how frequently does it occur. So OCD stands for obsessive compulsive disorder. And quite frankly, it's seemingly not that prevalent. We see it at 1.8% in women and 0.5% in men. So easily almost 3 times as more frequently in women, with about 50% of people that have OCD having serious impairment, meaning it prevents them from being able to do a number of things that they want to do. We take a look and we look at how frequently people get better using traditional methodology, meaning medications. About 10% get somewhat better, but 50% can get some improvement in their symptoms. So how do we do that? It's not only about the patient doing it, but it's about those people who have individuals that are able to help them, who are loved ones, who care for them, can be able to help them. So let's get a little basic understanding of OCD as a whole. So first is the O. The O component is obsessive, right? And so those symptoms are things that are kind of these constant fears that give problems and issues. For fears of germ or dirt, fear of making a mistake, fears of needing to be orderly or neatness or having symmetry or perfection, and fears of causing harms to oneself are some of the most common. The compulsive component deals with that. So arranging things in a specific way, bathing or washing hands over and over again, repeatedly checking things, a number of rituals in order to count them repeatedly, right? So one of the things that's kind of important with this is that there are other sequelae that we'll talk about in other videos that have issues with cardiovascular disease that they've actually been seen have been linked to OCD, surprisingly enough. So it's not just a benign dynamic, but what we need to be able to understand is for those people that we care about, how can we recognize this? So one of the things that we can look at is that the causes behind OCD can be multifactorial. It can be caused by things like genetics. It can be caused by brain changes that are present predominantly in the frontal cortex, or the front portion of the brain. In addition, it has similar areas that affect Parkinson's, Tourette's, and epilepsy. It can also be prevalent with things like PANDAS, which is an acronym that stands for Pediatric Autoimmune Neuropsychiatric Disorders with Streptococcal Infection. So those children that have had strep infections like strep throat or scarlet fever can sometimes have OCD resulting as a potential issue. And then childhood trauma, such as abuse or neglect, right? So when we get into different signals is to be able to kind of see all these different things. So what are some of the key points? Some of the key points are large blocks of unexplained time that that person's spending alone, constant questioning of self-judgment, and excessive need for reassurance, simple tasks taking longer than usual, staying up late to get things done, and daily life becoming a struggle. So those are some of the common aspects of different ways to be able to kind of identify and evaluate. So what are some of the traditional treatments? Some of the traditional treatments are therapy. So things like psychotherapy. And most of the time when people hear therapy, they're like, oh no, I don't know if this is going to work. But therapy has huge potential positive outcomes. And it's one of the number one out of the 5 things that we talk about that is probably pretty useful to encouraging that person to consider doing therapy. There are different types of therapies that exist that are out there, like CBT, which stands for cognitive behavioral therapy, where therapists can help patients understand their thoughts and emotions and how to be able to help alter harmful thoughts, which is pretty important, and find ways to help patients cope. There's also exposure and response prevention, which that therapist really helps expose you to those situations that are the fearful components, the images that make that person want to do the compulsion to do those things, and how to be able to kind of limit that if at all possible. And then there's also acceptance and commitment therapy, which basically helps that person learn to accept the obsessive thoughts and take power away from them. So when we've passed therapy, what are some of the traditional ways to treat this medicinally? And these are some of the meds and recommended doses. Traditionally, what we're talking about are serotonergic, a specific type of neurotransmitter, antidepressant medications that are utilized. And quite frequently, one of the ways that we can see to be able to improve patients' outcomes is to encourage them to be consistent with their medication. So as you guys know who follow our channel, we really intensely look at papers to be able to kind of decide what makes sense as opposed to just how we feel, meaning we look at the research and the science and be able to validate it so you can see it for yourselves. So one of those papers is the following: treatment of obsessive compulsive disorders and obsessive compulsive related disorders. And so what it does is it gives an outline of traditional treatment and therapy. And so one of those things that it looks at is what's the first choice treatment, as you can see, is that CBT that we talked about. So you want to encourage your loved ones to be able to look at that. Number two is to be able to look at medications if they don't have improvement. And so as stated, selective serotonin reuptake inhibitors are probably that initial secondary use. But then this is where things kind of get to be challenging. And so this is where having someone who can be that supportive person is huge. So if you can help them deal with the switches in different medication and how to be able to seek other alternative therapies, this is where things become key. And some of the things that are out there besides traditional medications after you switch to another selective serotonin reuptake inhibitor is to consider things like this: whether you may consider high dose SSRIs, whether you may consider ketamine, whether you may consider TMS, TDCS. These are things we've talked about. Other things that are more involved. Now, deep brain stimulation and ablative brain surgery seem incredibly involved. However, there's some other interesting things we're going to be talking about in this channel soon enough that are going to be things like focused ultrasound, which can be able to be utilized without surgical intervention that might be able to prove some degree of benefit. So let's get to the points of how you can be able to help. So how you might be able to help is that most people who think about OCD is that they believe that the person who has it can be able to control it just automatically with no degree of help or medication or therapy. And the fact of the matter is that they traditionally cannot necessarily change their behavior immediately. So if you expect that, you're only going to get frustrated. So you have to be able to modulate your own emotions. So that's number three. One is to help them pursue therapy. Two is to help encourage their medications. Three is for you to have proper perspective and being able to have some degree of grace to be able to understand that person that's in front of you. Four would be to consider, as mentioned before, not just taking their medication, but being an assistant to telling them and reminding them in an appropriate fashion. And also being able to help report to the physician as well as themselves what behavioral changes you've noticed. This is what I would say is really useful as a physician, because sometimes the person doesn't always see the change in themselves or the positive or the negative. And if they're willing to help you be part of their journey, to be able to document that as an outside observer is incredibly useful. One of the other things is how to be able to explain things that keeps communication clear and simple, because OCD can make things much more problematic when there are lengthy explanations and lengthy rationales and debates. So if you can be able to be clear, it helps be able to improve the outcome. And finally, an additional one is how you can be able to help with them being able to complete diaries and thought records, which can help them be able to track their obsessions. So those who tune into our channel say, well, what's the other science behind this? How can we be able to understand this greatly? And so we have other articles that are able to support that. But those 5 things that we just mentioned are probably the key kernels of how to be able to improve. But for instance, there's a paper as the following. That's a randomized controlled trial looking at ventral capsule and anterior medial subthalamic nucleus stimulation and obsessive compulsive disorder, clinical and imaging evidence for dissociable effects. Yeah, I know, super fancy, right? But we're going to make it understandable so that you can be able to get what it is that I'm saying. So at the end of the day, what they're doing is they're looking at the brain and they're finding areas in that frontal region and the thalamic regions that look like the following. And you can see it highlighted in blue in this picture and highlighted in green in this picture. And so at the end of the day, what they're finding is that there's ways to be able to use stimulation to be able to improve potential outcomes. So what they were able to use in this particular case was deep brain stimulation, but they're now saying maybe we can be able to utilize that case in other dynamics. So there's actually an organization that's the Foundation for OCD Research that has looked at genetic markers. It looked at circuits for mice because they were trying to be able to see is this replicated in humans. And human circuits and how the brain talks is hugely important because that aspect of how the brain talks can be able to impair, or rather improve the brain in multiple different ways. And what we think by this is it's not just by increasing the neurotransmitter level or affecting one area, but it's connected like a net. And if we improve one area, then we may not have improvement in another. So if we can improve it holistically, that we can get the outcome that we're seeking. And so this organization looks at TMS, it looks at DBS, and it looks at targets for specific drug development that are focused on single cell gene expression. At the end of the day, what I want people to know is that this is not just a disease that is like you're obligated to just have it affect you indefinitely with no potential benefit and never being able to improve. There's ways for you to be able to lean on the people who care about you and get benefit, as well as there are things coming down the line where we believe we can make even a bigger impact than what we are right now. If you found this video helpful, please hit the like button. If you're interested in learning about other different treatments, including that focused ultrasound that we talked about before, please hit the subscribe button so you can learn more about how to be able to punch pain in the face, get back to leading the life that you deserve, and really do the things that you want to do. Thank you so much and have a great day.